So let's talk about trauma. All right, so why do we care about trauma? Well, we care about trauma because head trauma is common, okay? It's a contributing factor to 30% of all injury-related deaths. Men are 3 times more likely to die from head trauma than women. And there's a very large societal and economic toll. So this is 2010 data where direct and indirect medical costs related to head trauma, $76 billion. And severe and fatal traumatic brain injury account for 90% of those costs. This is a diagram from this patient from this paper, which shows that head trauma in 2010 accounted for 52,000 deaths, 275,000 hospitalizations, and over 1 million emergency department visits. But there is probably a vast pool of additional patients suffering from head trauma who didn't seek medical care or sought it from outside of this traditional system here. So it's very common and very costly. What can radiology add to this huge problem? Well, we can help direct imaging workup. We can help provide rapid and accurate diagnosis. Some of the things that we can see on imaging help with predicting outcome, and then we can provide assistance in troublesome cases. So we're going to go through each of these areas. So let's first talk about imaging workup. Now, I have had feedback that as radiologists, we don't really have much say in what the ER docs do, what the clinicians do. But I think as radiology is changing, we will have more say in that. And I would encourage you to, pick up the phone and call if there's kind of an egregious misuse of imaging in the setting of trauma. And so we can all agree that adults with moderate to severe head injury and children with moderate to severe head injury should be imaged. And usually that's with a non-contrast head CT. It's cheap. It's fast, it's some radiation, but relatively low risk, okay? And how do we determine what is moderate to severe head injury? Well, we use the GCS score. And I will just point out to you that GCS scores of less than 13 in adults is considered moderate to severe, less than or equal to 13 in children is considered moderate to severe.